Common cold is the most frequent acute illness. It is a benign, self-limited, mild upper respiratory illness. Preschool children usually experience 5 to 7 episodes of common cold per year. This number for adults is 2 to 3 episodes. Common cold is separate from influenza, pharyngitis, acute bronchitis, bacterial rhinosinusitis, and allergic rhinitis. Over 200 subtypes of viruses can cause common cold, with rhinoviruses being the most common type. Other subtypes like adenoviruses and enteroviruses can also cause common cold, although they commonly cause pharyngitis and fever. Common cold can be transmitted through hand contact, small particle droplets from sneezing and coughing, and large particle droplets from close contact. The more time you spend with someone with the common cold and the closer the contact, the greater the risk of getting infected. Common cold viruses can stay viable on human skin for over 2 hours, and rhinoviruses may survive on surfaces for several hours. So these viruses can spread from contaminated surfaces. The contamination with alcohol may decrease the rate of transmission. Most of these viruses can reinfect after re-exposure, but with shorter duration and milder symptoms. There is no scientific basis that a cold climate increases the risk of respiratory illnesses like common cold. Symptoms are due to immune responses rather than viral infection, and they may differ from patient to patient. The most common symptoms are nasal congestion and rhinitis, including nasal discharge, dry or scratchy throat, and nasal obstruction. Other symptoms are sore throat, cough, malaise, sneezing, headache, discomfort in the ear and face, conjunctivitis, and sometimes fever, especially in children. Cough appears after, and it can persist for several weeks after other symptoms resolve. The color of nasal discharge is not an indication to prescribe antibiotics because it is a normal self-limited phase of uncomplicated common cold. The incubation time is usually between 24 to 72 hours, but it can happen sooner and the illness usually persists for 3 to 10 days. Diagnosis is based on reported symptoms and observed signs. To differentiate these conditions from common cold, we need to look at the signs carefully. The common cold is different from simple rhinitis due to sore throat and cough, bacterial pharyngitis due to prominent rhinorrhea and nasal stuffiness, rhinosinusitis due to facial pain and purulent nasal discharge, influenza due to high fever, headache, and myalgias, and pertussis due to vomiting and sometimes apnea. Complications of common cold are acute rhinosinusitis, lower respiratory tract diseases, asthma exacerbation, and acute otitis media. The mainstay of treatment for common cold is symptomatic therapy. Patients with mild symptoms usually don't need therapy unless their conditions worsens. In patients with moderate to severe symptoms, we have three categories. First one is medications that are most likely effective. First group of this category is analgesics like acetaminophen and NSAIDs. These medications help with headaches, earaches, muscle and joint pain, and malaise. Short courses of standard dosing are safe. However, these medications do not reduce the duration of colds. The second group is antihistamine decongestant combination medication. These medications are more beneficial rather than using alone. The third group is intranasal or inhaled cromolyn sodium. This medication helps with faster resolution of symptoms like rhinorrhea, throat pain, and cough. In the first 2 days of cold, it can be used every 2 hours during waking hours and for days 3 to 7 every 6 hours. The fourth group is intranasal ipratropium bromide, which is used to reduce rhinorrhea and sneezing, but does not help with nasal congestion. The second category is medications with minimal or uncertain benefits, like dextromethorphan for acute cough and decongestants alone, which can be used orally and topically for nasal congestion. Decongestants like pseudoephedrine and phenylephrine, especially phenylephrine, are used in cold products. Topical forms of decongestants should be used for 2 to 3 days due to rebound rhinitis and congestion. Also, decongestants can increase blood pressure in patients with pre-existing hypertension. Other medications in this category are saline nasal spray, expectorants like guaifenesin, honey, and herbal products. Zinc may also decrease the severity and duration of cold symptoms, but it is not recommended due to uncertain benefits and known adverse effects, like anosmia, which is partial or complete loss of smell, which can happen with nasal forms of zinc. The third category is ineffective treatments. There is no indication to use antibiotics in the absence of secondary bacterial infection. Antihistamine use alone and antiviral therapy are also considered ineffective. There is a small benefit to using vitamin C in higher doses of 200 milligrams per day in reducing the duration of colds. Thanks for watching this video. If you enjoyed this video, please like and subscribe to my channel. See you in the next video.